I became close to one of the patients. The last time I sat with him, he told me that he felt good, that he was going home. When I came back to work, they told me he had passed. I felt like I didn't do enough. That was very emotional for me.
She was in her mid-40s and she was dying. The family wanted to say goodbye. And in order for her to be able to be awake, she needed to be off of the ventilator, and I had to bag her. One of the hardest things I've ever had to watch was her 8-year-old, who was the same age as my son, laying across her chest, just asking her not to go, begging her. And knowing that there's nothing any of us could do.
Often in healthcare, after these events, we suffer in silence and we suffer alone. Emerge Stronger is a confidential one-on-one peer support program for any Cleveland Clinic caregiver distressed by an unanticipated clinical event, adverse event, or medical error.
They just gave me the advice that I needed, reassuring me that I'm not the only one that been through something like this.
In order for us to make care safer, we really need to create this environment where caregivers are willing to talk about the distress they experience as a result of errors or procedures that didn't go as planned. We have 123 trained peer supporters in a variety of roles. Having someone who's in the same role that you're in, who really understands, is so helpful.
It's going to give an avenue for my fellow caregivers to reach out and say, hey, I'm having trouble. I can't get this incident out of my mind.
Several years ago, I was caring for a patient who died by suicide. I spent years feeling guilt and shame and feeling responsible for his death. I think about how different my experience would have been if I had had someone who came alongside of me and walked with me on that really difficult part of my journey.
I had no idea, working at a hospital, how emotional it can be and how to get past some of the things that you see. They just reassured me that I'm not alone.